Great, thank you, and welcome everyone to Government Public Health Information during the COVID-19 pandemic. I'm Britt Fagerheim, and I am the outgoing co-chair of the Government Information Committee. Just a little bit of background on the committee. We are a committee of the Science and Technology section of the Association of College and Research Libraries. Our charge is to serve as a focus for STS member concerns about science and technology government issues and cooperate with other ACRL and ALA legislative groups as appropriate. The co-chairs for this past year were myself and Andrea Worth, and the upcoming co-chairs are Kara Watley and Andrea Worth. For a little bit of background on this presentation, it was formerly known as the Federal Science Agency's Update, and it's one of the major annual activities of the Government Information Committee. Typically, it takes place in person at the Midwinter and Annual ALA Conference, but the presentation was changed this past year into an online format for Midwinter to enable more participation, and then continuing online for the summer session to focus on presenters discussing providing public health information during COVID-19. To introduce our speakers, we have 3 speakers, and they will give their presentations one after the other, and then we will have a Q&A via chat after the presentations. Our first speaker will be Zoe Pettway Uno, who holds a PhD and is an education and outreach librarian with the network of the National Library of Medicine in the Pacific Southwest region, which is located at UCLA. Dr. Uno provides training in emerging trends in health sciences libraries, data management, citizen science, precision medicine using the National Library of Medicine resources. She has worked in medical, academic, and marine libraries in addition to her experience as a researcher in biology and environmental science instructor. Our second presenter will be Renu Lal. She is a pharmacist and has been with the Food and Drug Administration since 2002. She works in the FDA's Center for Drug Evaluation and Research in the Office of Communication Division of Drug Information, or DDI. Her daily activities these days revolve around managing communications related to COVID. However, she also works with DDI's Small Business and Industry Assistance Team to manage inquiries from the public regarding a wide range of topics, along with supporting outreach to help the pharmaceutical industry. Renu received her Doctor of Pharmacy from the Medical University of South Carolina and her bachelor's degree in pharmacy from the University of Connecticut, and has worked in industry, hospital, and retail settings. She is also an officer of the United States Public Health Service. And our third speaker will be Joey Nicholson, who is the interim chair, Department of Medical Library, and interim director, Health Sciences Library at the NYU Langone Health, NYU Grossman School of Medicine. Joey leads instruction on evidence-based practice within the medical school curriculum and residency programs at NYU, including finding, appraising, and applying emerging publications and data to pressing clinical scenarios like COVID-19. Joey has a Master's of Library Information Science and a Master's of Public Health. And I will now end my screen sharing and turn things over to Zoe.
Okay, just a moment. I'm just going to select my presentation. And you can see my screen now?
Yes, thank you.
Okay. All right. Well, thank you for the introduction, and good afternoon. My name is Zoe Uno, and I'm an education and outreach librarian with the network of the National Library of Medicine in the Pacific Southwest region. One of my responsibilities is to provide training on National Library of Medicine resources and outreach to our network members. I'm pleased to be invited to join you today and speak about access to public health information during the COVID-19 pandemic. Today I have one core objective, and that's to provide an overview of resources for COVID-19 public health information and data. And we'll do that by looking at some of the websites that are available for you to use. So first, some background about us. And this slide was provided to me by my colleagues at the Middle Atlantic region. This slide will help you understand how we in the NNLM are connected to NIH and the NLM. The National Institutes of Health, or NIH, is the nation's leading medical research agency with 27 institutes and offices. The National Library of Medicine is an institute at NIH and is the world's largest biomedical library, which maintains and makes available a vast print collection and produces electronic information resources like PubMed and Medline Plus. Medline Plus is directed towards the public, so that's our consumer health collection of health information. NNLM is the network of the National Library of Medicine and is an outreach program of the National Library of Medicine. The mission of the NNLM is to advance the progress of medicine and improve the public's health by providing U.S. researchers, health professionals, public health workforce, educators, and the public with equal access to biomedical and health information resources and data. NNLM's main goals are to work through libraries and other members to support a highly trained workforce for biomedical and health information resources and data, improve health literacy, and increase health equity through information. The NNLM is made up of 8 geographic regions, and as I stated, I'm in the Pacific Southwest region, and that region covers or serves Arizona, California, Hawaii, Nevada, and U.S. territories in the Pacific Basin. The Pacific Southwest region is based in Los Angeles, California, and located at the University of California, Los Angeles. In mid-March, the headlines told the story of closures across the country in response to COVID-19 pandemic. And as a result, all of the travel and in-person conference attendance came to a halt. And that's where we do a lot of our outreach. We go to conferences and provide access or information about the resources that we provide training onto our members and the public. I personally was scheduled to provide a half-day training on the new PubMed for a health sciences librarian meeting, which was taking place in Hawaii, and which was indefinitely postponed, and all of my other work became virtual. While the headlines told stories of stay-at-home orders and closures of all but non-essential businesses, we saw our websites begin to reflect the best sources of information on the constantly shifting pandemic. In order to ensure consistent messaging, our websites include the red banner that you see that directs visitors to the CDC, or Centers for Disease Control, and NIH websites for COVID-19 information. This shift ensures that all messaging related to COVID-19 is consistent, accurate, and timely information. And therefore, you'll notice that we exclusively point to CDC and NIH websites on the NNLM sites. So let's review the types of information that you'll find on the CDC website for your personal and professional use. I've added a blue box to aid in your navigation of the site. Those drop-down menus will highlight the various types of information that you will find. First, you'll see to the far left, Your Health, and Your Health includes information on testing, symptoms, prevention, if you are sick, travel, and other information related to taking care of yourself during this time. You'll also find FAQs to answer questions you may have. Next, we see the second drop-down, which is Community Work in Schools, which provides information relevant to educational institutions, businesses and workplaces, parks and recreational facilities, tribal communities, and the area that I want to draw attention to is the health equity section. Here you'll find information that addresses questions about health equity. These include health equity considerations and racial and ethnic minority groups, and what can we do? On the bottom half of the page, we see the CDC COVID-19 response health equity strategy, which is available in multiple languages in PDF. I recommend that you review a copy to understand the guiding principles, which include reduction of health disparities and use of data-driven approaches, the vision, which is that all people have the opportunity to attain the highest level of health possible, and the charge to reduce the disproportionate burden of COVID-19 among populations at increased risk for infection, severe illness, and death. And there are further details, but I'll let you read that in the interest of time. This section also points to more CDC resources on health equity and disparities. You'll also find information on social determinants of health and the Social Vulnerability Index. Social vulnerability refers to the resilience of communities when confronted by external stresses on human health, stresses such as natural or human-caused disasters or disease outbreaks. Social Vulnerability Index uses 15 U.S. Census variables at tract level to help local officials identify communities that may need support in preparing for hazards or recovering from disaster. So once you're on this site, you'll find a fact sheet which provides more information about social vulnerability, the SVI and its uses, data and tools download with information on using the data, as well as documentation on how the SVI was developed. And after I'm done speaking, I'll put a link to an article in there for you. Now, I won't go into detail here. I encourage you to explore the site to learn more about this resource and how you may better be able to use it in the work that you're doing. Okay, so now we've returned to the front page of the CDC website, and we'll take a look at cases and data section. Once again, you see the different types of data that are accessible through this website. And that includes cases and deaths in the US, testing data in the US, serology or antibody surveillance, special populations, mathematical modeling, SARS-CoV-2 sequencing data, as well as assessing risk factors. And if you click on the View All, you'll see the additional data that's available, which includes hospitalization, surveillance network, and more information about epidemiology, and again, frequently asked questions about data and surveillance. I also want to point out that on this page, you will also find more information related to health equity. So there's a section on race and ethnicity. And I also want to note at the top of the page, you'll see a link to COVID View, which is a weekly surveillance summary of US COVID-19 activity in the US. Okay, so this page actually notes that they draw the data or diverse data from streams across the information that's available and data that's information at the local, state, and national levels. So This site is a comprehensive site for locating data relevant to COVID-19. Okay, so a little more about the COVID View. It's a summary that provides key updates for the week in specific data areas. The surveillance goals are to monitor the spread and intensity of COVID-19 disease in the US, understand disease severity and spectrum of illness, understand risk factors for severe disease and transmission, to monitor for changes in the virus that causes COVID-19, estimate the disease burden, and produce data for forecasting COVID-19 spread and impact. You can return to the site for the weekly summaries and track specific data of interest. I just want to go back for a moment. So there is much more to discover on the CDC website. And again, I encourage you to spend some time interacting with the site so that you locate the information that you can continue to follow throughout the pandemic. In my next slides, I will briefly address some other resources that are available. Okay, so the next site we'll take a look at is the NIH site, which provides the research information that you may be seeking. Here, you'll locate information about COVID-19 testing, treatment guidelines, and I specifically want to note the link to ClinicalTrialsgov. And you'll see that that is the blue link above the grants and funding box and treatment guidelines. So if we take a look at that page, you're taken to a preset search of ClinicalTrials.gov that returns results of a search for COVID, SARS-CoV-2, and severe acute respiratory syndrome. And you can find more information about the search details by clicking the blue link that's contained within the blue box that I drew around that search results section. What you'll also notice is the number of studies. So this is a current view. So there are 503 studies. And the studies are those that are recruiting and those that are not yet recruiting. If you'd like to know more about using clinicaltrials.gov, we have an upcoming class on September 15th. And this is the information page regarding that class. And I'll also place that link in the chat box after I'm completed. So in order to register for a class, you'll need to register for a free account with the NNLM, and all of our classes and webinars are free. So I encourage you to register if you're at all interested in learning more about clinicaltrials.gov. Okay, so I'm on my last slides. If you're not already connected with the NNLM staff in your region, I encourage you to do so. They can help by providing training on many of the resources in the NLM portfolio. You can find your region on the map. For instance, 7 represents the Pacific Southwest region. Below the map on the website, you will find the link to the regions page to learn more about each region and how to connect with the staff there. So in my brief presentation, I provided you with an overview of some of the many resources that are available to provide you with public health information and data related to the COVID-19 pandemic. The information is maintained through the CDC website and NIH, and research information is available on the NIH site. I encourage you to explore these sites, connect with your local or your regional NNLM staff, and thank you for your time.
Thank you very much, Zoe. Our next speaker is Renu Lal.
Thanks, Britt. I am just going to share my screen here. Okay, can you all see that?
Yes, thank you.
Okay. Okay, hi everybody. My name is Renu Lal. As Britt said, I work at the Food and Drug Administration. I work in the Center for Drug Evaluation and Research in the Office of Communications in the Division of Drug Information. So basically, I work in the Center for Drugs, and it's basically our division puts out information for consumers, healthcare professionals, industry. We respond to emails, phone calls all day long, and we do a lot of outreach to provide information. So my main objectives in this short presentation, I want for you to be able to identify the resources by which FDA provides information to the public about COVID-19. There's a lot out there on our website, and I feel like if you don't know where to go for what, it's very confusing. But if you understand where to find the information, it becomes a lot more, it's a lot more clear. Understand the role of FDA's Center for Drug Evaluation and Research, or CDER, in COVID-19, and to learn how to support your audience, your researchers and students with COVID-19 related information from FDA. So FDA is a very large agency, and we oversee many different types of products. There are 6 product centers under FDA, and in addition to many different offices within those product centers and in addition to them. And each of them has a different function, but they all work together, especially across COVID issues. So I'm going to start with FDA's main COVID-19 webpage. This is the main webpage. When you go to fda.gov, there's a graphic in the middle, and if you click on it, you'll come to this. You can also go to fda.gov/coronavirus, and it takes you to the same page. This webpage contains a lot of useful information. You just need to familiarize yourself with the webpage so you know where to find what you're looking for. This on the right here is a snapshot of the top third of the page. And as you can see, it's inclusive of all the FDA centers. You see devices here, therapeutics, biologics. The blue box here that says on this page summarizes links to what you can find on the page. And right underneath it here, you see a search box, and this is the latest news, events, and press releases. And it also includes the daily roundup, which is published every day late in the afternoon, and includes the major items released that day. And of course, you can search by the search box as well for whatever topic you're looking for or area. Scrolling down the page here, underneath that, you will find a link that leads you to information about products under emergency use authorization, or EUA. You may have heard of this from researchers. These are products that have not been approved by FDA, but they are authorized for use temporarily under the pandemic. For example, you may have heard of the drug remdesivir, for which there is an EUA authorized. This is not approved by the FDA, this drug, but it's an investigational treatment being provided to hospitals and is authorized for use in this situation. So in certain emergencies, FDA can issue an EUA to provide access to medical products that may potentially be used when there's no adequate approved or available options. And there's a nice little video here to refer people to who are confused on what an EUA is. And we found that many researchers are confused about this. So we put this out. They're confused between what's an EUA, what's an EIND, which is an emergency investigational new drug application, and FDA approval. So this explains it very nicely. We also have a link right here to COVID-related guidance documents and policies, and these are helpful, especially to industry researchers, IRBs, and healthcare professionals. FDA has issued many COVID-related guidance documents on clinical trials, manufacturing hand sanitizers, developing new drug products, adverse event reporting, and there's more if you click on that. Underneath this, you'll find FAQs, which are our most commonly asked questions organized by center and topic, and they're also available in Spanish here. And then to the right, there's additional FAQs to other topics, hand sanitizers, and FAQs from the other centers. Underneath that, you'll find the popular coronavirus topics. which leads you to some quick links on trending topics. For example, fraudulent products. This page will take you to a database of warning letters issued by FDA for fraudulent COVID-19 products. This link here is great for consumers, the information for people with health conditions. And that's a consumer-friendly page with information about hand sanitizers, testing and treatment options, shortages, multilingual resources, and additional information. And if you scroll even further down the page, you will find links to each of FDA's centers' COVID-19 pages here. You see food, devices, drugs, etc. We also have contact information here for specific topics. So for example, if a company or researcher is interested in submitting therapeutic development proposals, if you click on drug developers, this will lead to contact information for our product development mailbox and additional information as well. Contact information is also available here for physicians seeking emergency INDs access. We have a team that helps physicians gain access to investigational drugs 24/7 for COVID and for others. Here, people can also report problems, fraudulent products, or problems with importing products. There are also links at the bottom of the page to other federal government agencies, their web pages about COVID. But if you're looking specifically for drug-related information, you want to click on drugs here to get to Cedars COVID-19 webpage. And just briefly, Cedars' role in COVID, there's currently no FDA-approved drugs to treat COVID, but Cedars working closely with researchers to accelerate the study of potentially beneficial drugs to treat COVID. Cedars working to address drug shortages and to prevent shortages. And then finally, safeguarding against unsafe drugs, maintaining surveillance of the safety of prescription over-the-counter drugs, reviewing applications. So there's a lot that we do to help ensure the health of patients. So, we have our website, but FDA uses many different means to reach the public, which not everybody is aware of, and we do want to increase awareness of this. We have, of course, our webpage, but we also have email subscription services or listservs, and there's multiple ones through which we push out information. Specifically for COVID-related information, you may want to sign up for the Drug Information Listserv and the MedWatch and Recalls Listserv. Also, our Small Business and Industry Assistance Listserv pushes out information specifically for industry and researchers. Note that none of these lists are dedicated only to COVID-19, but if you sign up, you'll receive COVID information along with other information that we typically message. We also have a strong presence on social media. We push information out through Twitter and Facebook. We have some LinkedIn pages that we push information out through as well. And we hold webinars. We recently held a highly attended SBIA webinar on clinical trial conduct. We put out podcasts. We put one out on the safety issues associated with hydroxychloroquine. And then we also issue press releases, which are picked up by the mainstream press. So this is Cedars' COVID-19 drug-related page. It's very useful to consumers, healthcare professionals, and industry. Here in the center of the page, you'll see two boxes. The first box discusses Cedars' engagement to protect public health and the work that we've done, which I already reviewed. The second box here is CTAP, or the Coronavirus Acceleration Program. And this is a special emergency program for coronavirus therapies. It helps to move treatments through quickly as possible while maintaining FDA standards for safety and efficacy and quality. CTAP also provides a special contact for sponsors to reach out to for questions about COVID-19 drug development, and that's the COVID-19 Product Development Mailbox. So people can, researchers and companies can write to that to address, get answers from FDA when they have questions about the development of drug products for COVID. And when you click on the image, the CTAP image, you come to this dashboard, which has some useful data that FDA has released on COVID-19 trials and treatments under review. As you can see here, when I took this screenshot, there were over 510 drug development programs in planning stages and 2 drugs currently authorized under EUA. As I mentioned earlier, there's no drugs approved to treat or prevent COVID-19, but this graphic shows approximately how many products are in early and late stage testing. So there's limited information there's limited information the FDA can release on these topics because investigational treatments are confidential, cannot be released by FDA, but we do put out as much as we can here. If you scroll down Cedars COVID-19 webpage even further, you see that we have individual web pages for all of these topics listed here. I'm not going to get into all that, but I encourage you to do so on your own time. At the bottom of the page here, we've got additional resources with a great deal of data that you may be useful to your audience. You may already be familiar with the COVID-19 Treatment Hub, which was developed with the Renu Lal Foundation, and it has a lot of information on clinical trials, testing, companies with COVID-19 therapies that are developing them, FDA updates, and a lot more. There's also a link to FDA's Sentinel system for COVID-19 and to the COVID-19 real-world data elements harmonization project. So the Sentinel system activities, they range from monitoring the use of drugs, describing the course of illness among hospitalized patients, and evaluating treatment impact of therapies being used under real-world conditions. And then the COVID-19 real-world data elements harmonization project, its goal is really to harmonize a list of COVID-19 data elements with several common data models and open standards. And these data elements have been identified with the COVID-19 Accelerator Collaborative Initiative. So FDA is we're collecting a lot of information in a variety of ways to evaluate the safety and efficacy of potential therapies and to facilitate emergency access for patients. We also have a COVID Cure ID app, which is very useful to researchers. It's another way that FDA is capturing data through this Cure ID. Cure ID is a collaboration between FDA and NIH, the National Center for Advancing Translational Sciences. And it's a web-based tool. It enables healthcare providers to share their real-world experiences treating patients with repurposed drugs. And those are existing drugs being used in a new way through online case reports, through their smartphone, computer, mobile devices. So that's something that you may want to share with healthcare professionals and researchers. And I'm just briefly going to go through a few web pages targeting consumers, healthcare professionals, and industry that, depending on who your audience is, you can share with them. So consumers, this top page, this yellow box is from the Cedars COVID-19 page, and we've got here FAQs, we have resources for patients. This link here, methanol contamination leads to our do not use list for hand sanitizers, which has been in the news and has a lot of information that's useful to the public. These two links here, these two screenshots on the bottom are from the main FDA COVID-19 page and would also be very useful for consumers. Also on the main page, I had mentioned under the popular coronavirus topics, we have a link that's useful to consumers as well. These are all useful to healthcare providers. On the COVID-19 page here, we have resources for healthcare professionals as well, and that links to information about EUAs, PPE, investigational treatments, fraudulent products, toolkits. And these are some other links that would be useful for healthcare professionals and researchers as well. And then finally, industry, I covered CTAP. I mentioned the COVID-19 product development mailbox for drug developers. We also have a clinical trials conduct mailbox for researchers that have questions about clinical trial conduct during the pandemic. And then we have a My Studies app in addition to the Cure ID app. The My Studies app is available for investigators to obtain informed consent when they can't come face-to-face with the patients because of COVID-19. And finally, there's always challenges in getting information out. FDA's messaging is out there, the information is out there, but it doesn't always get to the people. If somebody doesn't frequent the FDA webpage, doesn't follow FDA on social media, it's difficult to get that information out unless it gets out through the news. So we want to make sure that people are receiving correct and up-to-date information. There's a lot of misinformation out there. And I think as librarians, you know, you can do that by sharing the proper resources and helping FDA to overcome our challenges. And this is the government response to coronavirus website, which also has many different useful websites that you can refer people to, which you may be familiar with. More key resources, and these I've covered in the presentation, but I just put them all on one page here. And then finally, if you or anybody you know has questions, please feel free to refer anyone to our Division of Drug Information. We have a staff of over 40 healthcare professionals, and we answer inquiries all day long, so feel free to use our services and provide our information. Thank you.
Great, thank you, Renu. Our third speaker will be Joey Nicholson.
Hi, everyone. I need to be able to share my screen, and then I can show you my slides. I think Renu has to stop sharing her screen first.
Perfect, you should be set, Joey.
Thank you. Okay, so you should be able to see this now. So a little bit different from the other two presenters. I think you can see this, right? Hold on. Zoom, share.
Yep, we can see the slides, not in presentation view yet.
Is giving me a weird message. Okay. So I'm going to try to give you a quick more of an on the ground. How did our academic medical library respond to COVID-19, which may reflect some of the challenges that you all are also facing in responding to the needs of your own institutions and using some of the resources that Zoe mentioned and that Renu mentioned from lots of different kinds of federal sources. So to give you some context about NYU's Health Sciences Library, we report up through the hospital. We are not a part of the regular academic library on NYU's main campus. So we're situated a little bit differently than some libraries. And this affords us a lot of flexibility in terms of what we can do when we're responding to things like this. And it gives the hospital administrators and the School of Medicine administrators a lot greater access to our expertise and a lot higher awareness of who we are and what kind of value we can provide. So hopefully you'll see a little bit of that. So the three things in particular I'm going to talk about are our responses to patient care information requests, to educational sessions, and for COVID-19 data sets. For patient care information, this varied a little bit. Our librarians did respond to requests for direct patient care. So that was when there was a patient in the hospital and a clinician had an immediate problem or trying to figure out something on the fly. They could reach out to us and we would see what we could find. We also did a lot of work for clinical trial protocol development as the institution was trying to determine what clinical trials it was going to run and still is in that process. They did reach out to us to try to help see what the landscape of literature was. Same thing with clinical practice guideline development. Especially early on, there really were not existing clinical guidelines. And so the clinical guidelines committees wanted to make sure the guidelines that they were coming up with as treatments continue to evolve were based on the best available evidence that was currently existing. So these requests came from our library's website form, but also a lot of them really did come from individual emails. So we have a liaison system where we each of the librarians works with different departments. And so our contacts in different departments often will just shoot us requests. And that's sort of like the easiest way they could get in contact with us. One of the cons of this situation and this style is that every request really was desperately urgent. Wrong or missing information, if we missed anything, it really could result in mortality. So we really did feel like we needed to be very careful and be very clear with what they wanted and what we were going to do to respond. Pros of being able to respond in this way are certainly that the leadership was very appreciative of our efforts. And another pro of having us involved was that our librarians are used to systematic review searching, and we could really easily apply those standards to these tasks and make it more of a structured, clear, reproducible framework for what we're doing with each request. And of course, our reality was that all of these were COVID-19 requests, so no really wasn't an option. We just had to figure out how to do it in the fastest way that we could. And some additional added value are that often the requests that came in for lit searches in particular were just for PubMed. People said, you know, I just want to know what's in PubMed. And typically we would come back to them having searched at least 5 databases and a couple of preprint databases, which more than doubled the amount of literature that was available on a given topic. Most of the time, I would say that this stunned people, that they somehow are still unaware that there is literature out there that's not in PubMed. Of course, these are clinicians, and so they are highly used to using PubMed all the time for everything. But I think they were really grateful for our expertise there. And additionally, our critical appraisal skills really did help us deliver better results to the clinicians within the context of all results. So, you know, using the critical appraisal skills that we have, we're able to point out to them, these are really the higher quality evidence, the better designed trials, the better designed observational studies, and give them a little bit of the context of what they're seeing so that they're not just making decisions based on an abstract that looks nice, that they have a little bit of a sense of what they're looking at. We also responded to this crisis with a lot of educational sessions. The restructuring of NYU Langone Health staff due to remote working led to a huge increased demand in educational sessions. Like many places, I think we rapidly went to working remotely. The second week of March, all of a sudden, everyone was working remotely who was not in a clinical space. So we did sessions on critical appraisal. This was generated from requests from medical students and from some of our trial researchers. Specifically, we focused on how do you evaluate preprints and observational studies, because that is the bulk of the literature that was being used. How do you determine what the biases are and how bad those are and what you might need to do about them? There was also a great deal of training on REDCap and e-consent. So as new researchers were setting up COVID-19 clinical trials, they were rapidly onboarding new teams who needed to do data collection and needed to do consenting for clinical trials and had never used REDCap before in many instances, which is an electronic data capture system. So we rapidly deployed this training, and I think at this point it has been several thousand employees who've gone through this training. And then another one was R and R Studio, programming languages to do data analysis. So we've done a few of those classes, just very basic introductory data analysis. And this is to help basic science researchers who are no longer in their labs, but are switching over to do different kinds of data analysis to get a little bit more comfortable with that particular computer program in order to refocus the work that they're doing right now. Again, these requests came mostly from individual emails and personal relationships from across the medical center. But one con of this, which should be no surprise to most of you, is that it's a very heavy lift to get so many online classes live in a short period of time. And it's hard to continue to respond to this increased demand as, you know, hundreds of our faculty, staff, and students would say they wanted to come to a class, and you could only, you know, you could do sort of a recording that they could watch, but then they get a little bit less out of it. And a lot of people, particularly around like data capture, may have individual questions about how to set up their forms. So scaling that became very difficult. A pro of this was certainly that we capitalized on our existing skills and our existing relationships. And it really did help meet an immediate and pressing need of the institution and helping to retrain all of these people who were now doing very different things to what they were used to doing. And again, our reality is that this was a COVID-19 request, so no was not an option. We just had to figure out the best way that we could do this given our limitations and given the situation. And finally, I'll switch over to data. You may not know that NYU has the NYU Data Catalog. The aims of the data catalog are to increase visibility of researcher-generated data. This is by NYU researchers. It's also intended to help support interdepartmental collaboration and help our researchers to locate and understand other data sets. This data catalog is part of the Data Discovery Collaboration, which is a consortium of libraries that are all working in data discovery. These are mostly academic medical libraries, but there are some others as well. The DDC they collaborate to share best practices for cataloging. In particular, right now have been cataloging COVID-19 data sets, and they're trying to reduce inefficiencies there. So with COVID-19 research, we have been doing ongoing cataloging of these data sets that are coming out within our data catalog. This includes a de-identified COVID-19 electronic health record data set that is for NYU researchers specifically. A lot of other COVID-19 research generated by our NYU faculty, so genomic data and other kinds of data that may not be clinical electronic health record data sets. And additionally, we are cataloging publicly available COVID-19 data sets, and that's in the joint effort with the DDC, the collaboration. The data catalog does have ongoing integration with teaching and research activities around NYU. So we use the data catalog a lot when we're teaching. So all of the classes that I just mentioned, we use the data catalog to help our students and researchers get to the data that they're then going to analyze in R, or that they're then going to apply to patient care, that they're then going to be doing something with. Providing these data sets in the catalog as well does help link subject matter experts, so local people who are at NYU, who our students and researchers might be able to reach out to. And then finally, I mentioned we have a de-identified COVID-19 electronic health record data set. So our clinical informatics faculty and medical center IT created this data set from our electronic health record, and this goes across our hospital system. So we have 3 different main hospitals. And the point of this was to facilitate cohort identification for clinical trials, to be able to do some exploratory research and be able to do some very basic hypothesis testing of the existing patient data that we have. We were very lucky that they reached out to us at the Health Sciences Library to help provide training and support on use of this data set and to help with user access to this data set. Of course, there are cons. The con of this is that it required very rapid upskilling on the limitations of electronic health record data for research. Same like a rapid learning about SQL frameworks and accessing data on the Hadoop platform. Fortunately, we have a really great data team who was able to do that and didn't complain about it 1 minute and just took it on as an exciting challenge. Pro of this is that the informatics faculty has been super responsive and they're now on a joint Slack channel with our data team, doing a lot of knowledge sharing and really helping make this a better, more accessible data set for our researchers. And again, because it was a COVID-19 request, we couldn't say no. We just had to find a way to do what was asked of us. And so far for this particular data set, the support to date, we have done trainings for 3 different sets of internal medicine residents who are on a research track. So that's about 40 residents. So how they can access the data, what they can do with it, what are some basic ways that they can begin to analyze that data. We do have a scheduled class next week for anyone who's at NYU Langone Health. Within the first 2 hours of it opening, there were more than 70 users registered to attend this class. So there's a lot of interest around our medical center on having improved access to data, understanding it, being able to do analyses, in addition to lit searches and a wide variety of other things. Some general challenges and recommendations. It was a really heavy workload under a really urgent time crunch. I think that within our library, we did allow a lot of other non-essential work to slide, and we allowed people flexibility in their working hours. This is really what enabled us to be able to do this work. Often search requests would come in at night or on the weekend, and they would really need to have an answer immediately. And if that meant for me that I did a search at midnight on a Friday, but maybe took a longer lunch break on Monday, that was fine. We tried as much as possible to encourage our staff and faculty to practice some self-care, because it's a really hard time right now, and there's a lot more going on than just the work that you need to do. These were also complex topics with high consequences. The solution to that for us was that we leveraged the existing expertise within our library, the library community as a whole, and our institutional partners. I don't think we would have been able to do as much as we've been able to accomplish without relying on each other to help answer quick questions, without reaching out to other medical libraries who we were aware had faced similar questions or were maybe doing something else similar as well. No need to reinvent the wheel there for sure. And definitely working with our institutional partners to understand exactly what it is they need, build on what they've done, and make it a better, more useful resource for our institution. And then another challenge was that there are similar demands from all across the organization. So we would get requests from folks in internal medicine and folks in pediatrics and folks in emergency medicine, and they might be very similar requests for literature searches. So as much as possible when responding to that kind of request, most of us use a framework of recording and reusing our content when possible. So that is something like saving your search strategy so it's easily replicable, just documenting what your process is, what the search terms were, what the question is and who asks questions. Often this also meant we were able to link researchers who might be working on something but from different departments. And that's all I got.
Thanks, Joey. And Kara will facilitate our the time we have left for a Q&A.
So let me unmute myself. I have been trying to keep track of the questions that were coming in so that you all could ask them as they came up to you, but our panelists would be able to address them here at the end. So I've got I think 6 or so questions, and I'll start off with one that came in from Sydney Louie during Zoe's presentation, and I'm looking for more information from the clinical end as I'm tasked to monitor documents pertaining to the COVID-19 regulations and guidance for facilities, clinics, nursing homes, hospitals, etc., particularly those issued by the CMS. Zoe, can you tackle that question for us?
That is a question I will take back to our experts, and I can get back to Sydney with a response to that, or I can get back to so that it can be shared with the remainder of the group.
All right, that sounds great. Renu, Sydney also asked a similar question of you. Can you help answer that question for us?
Can you repeat the question in context of FDA?
Absolutely. So Sydney says, I'm looking for more information from the clinical end as I'm tasked to monitor and download documents pertaining to COVID-19 regulations and guidance for facilities.
I mean, I guess it depends what exactly you're looking for. If We have information, like I said, if you have questions about clinical, if there's researchers with questions about clinical trials or clinical product development, we've got, you know, specific dedicated mailboxes for those. But if you're looking for data about products in clinical trials, we would not be providing that. We can only provide data about product or information about FDA approved products. Does that answer the question?
Thanks very much for tackling that. Sydney, if you're still around and you have a follow-up question, if you put it in the chat, that would be great. And our panelists will either try to tackle it now or get some additional information. I'll move on to the next question. This is also a follow-up for you, Renu, which is about how to access previously released versions of regulatory communications. Do you have information about how one would do that?
Well, everything is documented through the Freedom of Information. So you could always try to request, for example, if you want an old guidance or something like that, you may be able to get that through FOIA. I'm not positive, but I would start with that. If you go to our FOIA webpage, FDA's webpage, there is contact information where you can contact Cedars FOIA department directly.
Okay, thank you very much. And I've got a couple of questions that have come in for Joey. Aditi Bandyopadhyay has asked about the NYU data catalog and if it's freely accessible. Do you want to talk a little bit more about the data catalog, Joey?
Hi, sure. And I can also respond briefly to Sydney in terms of being asked to monitor and download documents with regard to regulation and guidance for facilities. We do some of that as well, and I haven't found a really amazing way to do that. You know, I do go to our state Department of Health's website to look at their regulations on a pretty regular basis, and to whatever comes out on the CMS website itself. I also try to take a look at ACRI. They are a guidelines repository agency, and they have a pretty thorough set of guidelines, not necessarily government guidelines, but there are a lot of nonprofit, non-governmental groups that are putting out guidelines related to patient care and different kinds of guidance. So ECRI, I would check, but otherwise you just have to go to the websites for those organizations. And there's also, for previously released versions of things, I haven't tried this particular resource yet, but there is a novel coronavirus web archive. So you could try searching that to see if it has archived versions of COVID-19 regulations or data. I don't know what's in it because I haven't tried searching it yet. I just know that it exists in the world. For the data catalog, yeah, the NYU data catalog is totally free. Anyone can access it. It does not, we don't have the data in the catalog. It only describes data that exists. So there usually is a contact information or a link out to the website where the data is. But certainly it is free to search. Anybody can search it. And there are a lot of different parameters that you might use to search the data catalog.
And Aditi was also wondering, what 5 other databases do your librarians search for COVID-19 in addition to PubMed?
So I just typed into the chat. Normally, PubMed, Embase, CINAHL, Web of Science, Scopus, and Cochrane Central. I've also, depending on the nature of the question, sometimes added in PsycInfo, and that's in addition to medRxiv and bioRxiv as well. Sometimes I have also rounded that out with a Google Scholar search to be as comprehensive as possible. But it really depended on the nature of the question and who it's coming from. But those are the core ones that we tended to use.
Well, thank you very much, Joey. You are amazing because we're at time and we got through all of our questions. Everybody in the attendee list, please join me in a virtual thank you for all of our panelists for joining us here today. I've been frantically taking notes. We're going to make the notes, and if the panelists will share their slides along with the recording available for all of you to review later. I learned a lot. Thank you all. Have a great afternoon. Bye, everybody.